Hello, my name is Jay Kahtri. I'm Director of Complex Coronary Intervention at Cleveland Clinic in Cleveland, Ohio. I'm really happy today to share with you my experience with the ASAHI Gaia Next Series Guidewires for chronic total occlusion intervention. This is essentially the big news. It's kind of the punchline for the talk. What is the difference between Gaia and the Gaia Next Series? Basically, it's far more torqueable and far more penetrable. And we're going to go into some of the details about how this was achieved and why this is helpful for CTO intervention. So these are some of the basic features, some of which you are already familiar with, some of which are new. First of all, there's a microcone tip designed specifically to engage the lesion efficiently and effectively, and also to create alternative pathways to get through the CTO. If you think your initial path is incorrect, this microcone allows for very easy engagement with the CTO cap. All of these wires have a appreciate 1 millimeter tip for convenience, and also this tip is pre-shaped to prevent any potential damage to the wire, and it facilitates very precise movements inside the lesion. It's typically the type of shape that you would manually place on a CTO wire anyways. The other feature, which we are all familiar with at this point with many of the ASAHI series wires, is Act 1. And what this is a composite core dual coil technology, which dramatically improves torque response of the guide wire, as well as durability of the tip. This is achieved by a conventional spring coil with a second coil within the conventional spring coil, along with the conventional core of the wire with a second core applied parallel to it. So these three features we have in several wires already available. What's new now is X-strand. Now, X-strand is the iteration of spring coil technology, which has been pioneered by ASAHI. What they've done is a conventional spring coil that's applied to most coronary guide wires is now made up of a rope of many, many smaller wires. And I'll go through some of the details through the presentation. The main advantages of having this construction is the ability to avoid being trapped. So these wires are so capable of digging into a lesion that there is some danger of the wire being trapped in the lesion, and this reduces the risk of that. And it also reduces the risk of the wire fracturing in the event that the wire does become trapped, both of which are clear advantages over the current technology. This is sort of a long history of all of the iterations that ASAHI's brought to us in the coronary guide wire field. It all started out with Miracle-Gro wire, which was originally developed as a CTO guide wire. After Miracle-Gro, we got the Confianza or Conquest family, depending on which market you're in. This was developed primarily as a penetration wire, something to create a hole in the cap. After that, we received Fielder XT. This is a soft tapered polymer jacketed wire, which I think was initially marketed for retrograde, but many people use this to probe the proximal cap or to perform knuckle wiring. After this, we got the first guide wire with Act 1 technology. This is the ASAHI Sion wire. This is that super high torque response tip durability technology that is now being applied to many guide wires that we use on a daily basis. But the first wire in the series to have Act 1 was the ASAHI Sion wire. About 3 or 4 years ago in the US market, we received Fielder XTA and XTR. So this is taking the construction of the Fielder XT soft taper polymer jacketed wire and applying Act 1 to it. So now we have the soft taper polymer jacket with super high torque response and tip shape retention. Next, we got ASAHI Gaia. So Gaia added on top of Act 1 this new microcone tip to engage the cap. And then more recently, we received ASAHI SUO 3. Now, what ASAHI SUO 3 has is a new concept for the spring coil, which is constructed from a rope to allow for much more torque response and anti-trapping ability. And then the ultimate iteration now is X-strand, which is the ASAHI Gaia Next series. And we'll go through some of the advantages of this technology. So this is the overall schema of how this product pipeline has come to fruition. So what is this concept of intentional wiring? So the way that the wire is constructed is that it allows the operator to sort of feel the various composition of the plaque as you traverse a lesion. So as the wire is advanced to the lesion, the nose cone engages the plaque and digs into it. The wire is designed on purpose to deflect when it hits something very hard and calcified. So it's sort of similar to, the best way to demonstrate this is sort of like a watch bracelet. So if you have a watch bracelet, when it hits something hard, it can flex, right? That's the tip deflecting. When you rotate the wire, you see how strong my wristwatch is. You can't twist this. So the strength of the wire is in its torque response, but it's soft enough to deflect when it hits something hard. And you use that feel and the response on fluoroscopy to understand where you are in a lesion and how safely to navigate through. That's the idea of intentional intimal or subintimal wiring through a fibrocalcific plaque. And we'll show you some examples as I move through the talk. So let's talk about this a little bit more carefully. So the directional control is basically the torque response of the wire. So how easily is it to rotate the direction of the tip of the wire as you're advancing through the lesion? And the second concept is deflection control. How likely is the wire to deflect when it hits something hard? And it's these two ideas that allow you to safely traverse lesions in a CTO. So as this wire hits something hard, it deflects like the bracelet on a watch, it just deflects. And so now the question is, can you get the wire to redirect? And that's the torque response. And so this is that rotational force. So rotate the wire. Most of the strength is in rotating the wire. It has such exquisite torque response that even though it's wedged into a hard lesion that causes it to deflect, it still has the torque response to rotate so that you can point in a different direction. And then you can push again, and using the combination of deflection and rotation, you can navigate your way through a CTO. Now, this is in contrast to a stiff penetrating wire like a Confianza Pro 12. These wires are just stiff, and so they go straight. There's really no way to deflect these wires. They just basically go in the direction that they're pointed at. And this is a little bit more of a risky proposition trying to get through a relatively long CTO, because the wire is going to take the natural curve of the artery and maybe exit out. So much higher risk of perforation because there's no deflection. It's simply push from penetration. So, when you encounter fibrocalcific plaque, the wire experiences stress, and the stress is at the very tip of the wire, and that's what you're looking for on fluoroscopy. You're seeing that the wire tip deflects. That's the stress of it hitting something very hard, and that's your indication that now it's time to change the direction. And thankfully, the wire has amazing torque response, and you're able to point the tip in a different direction to try and bounce off of that hard plaque. But hopefully stay within the confines of the vessel architecture. So the new lineup of ASAHI Gaia Next comes in a Gaia Next 1, Gaia Next 2, and Gaia Next 3. And it's the same concept as the original Gaia series, where Gaia 1 is the softest wire and Gaia 3 is the most penetrating wire, with Gaia Next 2 being somewhere in between. Now, interestingly, when you look at the actual stiffness at the tip, they're not too far off. So the very tip, the part that we were going to watch deflect, they're not that different. But as you get further and further away from the tip, you can see how stiff a Gaia 3 is, Gaia Next 2nd, and a Gaia Next 1st. So Gaia Next 1st is by far the softest of the wires, even though at the very tip, they're not too different from each other. So let's talk a little bit about the microcone. So what is the advantage of having this cone? So as the artery is engaged, this cone can puncture into the lesion. But if you're not happy with the progress that your wire is making, what your cone allows you to do is to select out different paths if you're not happy with the original path that you took. And this is different than a conventional guide wire, which has a rounded tip on the end of the wire. So you can see in this cartoon, what happens with this wire is if it's in the wrong path, it's very, very hard to let this wire catch the correct path. It keeps sliding into the incorrect path. Whereas if you have the nose cone that's tapered like on a Gaia, it increases the possibility of engaging various pathways. Even though you created one pathway, the nose cone allows you to dig through and find different pathways. And hopefully find the true lumen distally. So in summary, there's flexibility for better maneuverability inside severe tortuous lesions, very high torque response transmission to allow for precise wire control, improved penetration capability in tough lesions, and very, very high tensile strength as compared with conventional coils, which improves the durability and the safety of this wire in a very recalcitrant lesion. This is another just illustration of all of the structural attributes of the wire, the microcone tip, the pre-shaped 1 millimeter distal tip, stainless steel core, the Act 1 technology, which is the coil within the coil, and the parallel core system, the X-strand technology, which we talked at some length about, the hydrophilic coating on the distal 40 centimeters, the 15 centimeters of distal radiopacity. These wires all come in 190 centimeter lengths. This is just the catalog ordering information. So for Gaia, next 1, 2, and 3. And next, I think what I'll just do is show you some real world cases of patients that I've taken care of recently with the Gaia Next series. So this is a patient that we did an IVUS guided puncture for LED CTO. And with an XTA, you can see we quickly got subintimal. You can see underneath this XTA, you can see the contrast of where we needed to be. And we think that we roughly deflected off the cap right around here. This is where these super high torque response wires are very, very handy. So this is a Gaia Next second, which we're using to engage that area where we had deflected. And just using the torque response and feeling and looking at where it deflects and doesn't deflect, we were able to quickly re-enter the LAD with very high level of confidence. I think you could have made the argument to have left the XTA in place and parallel wire this, but we were very comfortable with understanding where we had deflected, and we were very easily able to use the nose cone, the tapered nose cone, to engage this area of deflection, and then just use the torque response to allow the wire to dig through and find a path. And it very quickly freed up and sailed down the artery. This is another example. This is one where we did parallel wire. So this is a circumflex CTO where I think the XTA deflected off course right here. And so what we did is we just took a Gaia Next 1 and parallel wired. We simply engaged this area of deflection and used that same nose cone technology to engage that area of deflection and torque back and forth until we felt the wire pop through. And then before you know it, we were in very safely and efficiently and got this case done pretty quickly. I should say on this case, even though we were through, we had a lot of trouble getting the microcatheter across and ultimately ended up having to rotablate this lesion. So it just illustrates you, even a Gaia Next 1 is strong enough to get through a super heavily calcified artery that is really underappreciated on fluoroscopy, but it was recalcitrant enough to where we really couldn't barely get a microcatheter through. This is another recent example of mine. This is a very proximal RCA CTO where we tried at great length to get an integrated system started and just simply couldn't. There was just no way to get an integrated system started. And so what I did is I came in retrograde, and it's a 2-3 millimeter CTO, and I thought no problem, Confianza Pro 12 will pop across. But you can see on the left panel, Confianza Pro 12 having tremendous difficulty puncturing through. And this is what we were seeing on the antegrade side too. We simply couldn't puncture this. We couldn't Carlino through it. We couldn't use base. There was just no way to puncture on the proximal side. Felt similar resistance to the Confianza Pro 12 on the retrograde side. So we swapped out to Gaia Third Next, which is on the right panel. And you can see Gaia Next Third very quickly just drilled through and ended up in the aorta and made this case complete safely, even without a reverse cart. This is another nice example of a Fielder XTA in a patient in cardiogenic shock. We're doing multivessel PCI and had already fixed the patient's left dominant circumflex. Now we're doing the LAD CTO. And you can see the Fielder XTA after an IVUS guided puncture very quickly got subintimal. And we think the point of deflection is right here. And so I'll show you with the upper left panel, this is Gaia Next 1 at the point of deflection where there's a bifurcation of a diagonal and an LAD. And then if you look at the left lower panel, again, nose cone technology to engage the cap, exquisite torque response to torque through. At any point, there's a point here where the deflection resolves and the wire just frees up, and that's where it pops across this relatively short CTO. And then in the right panel, you can see we're clearly in the lumen, and we just advanced the wire down distally and completed this case uneventfully. So these are sort of real